Hello dear patients, today we are going to discuss the topic of peeling on glans penis. This peeling was quite laminar. A man came to us with such peeling. Initially, the symptom was less severe. Unfortunately, we don't know what was it, as at that time he went to the dermatovenerologic dispensary at the place of living. On observation, a diagnosis of candidosis was set. No analysis for candidosis were taken. Fluconazole internally was prescribed. Clotrimazole cream was prescribed, and as a result of that, such symptoms of peeling increased. According to the patient's words, they increased approximately 5-6 folds, and each appeared in the area of glans penis and in the area of foreskin. You can see how the skin peels off from glans penis. Of course, this bothers and scares the patient a lot. In this case, based on our experience, this is most commonly an allergic reaction that quite often appears on such medications as fluconazole, flucostat, diflucan, etc. I have many times noted that if the patient has allergy, then it usually increases secondary to intake of such medications. Initially, these prescriptions were cancelled for this young man, and after that analyses were taken for candida, for sexually transmitted infections. However, they were negative. Bacterial culture test was also taken, and it showed that on this area of skin of glans penis and foreskin, normal flora grows. Analyses for allergy were also taken on an empty stomach. You can watch a separate video on our channel about what it is. Immunoglobulin E was increased. It was about 9.5 to 10 times in excess. Eosinophiles and basophiles were increased, and this suggests an initial allergic reaction that was increased by efforts of doctors who prescribed such medications without any analysis done. No candida were there, and this was indirectly confirmed by our analysis. However, considering that such symptoms increased, it's most likely that they were not there in the beginning. As I already said, according to my personal experience, such medications quite commonly induce an increase of allergic reactions. This patient was consulted by us together with an allergologist, and he was examined by an allergologist. We are not going to talk about it now. We prescribed the classic anti-allergy treatment, sodium thiosulfate, calcium gluconate, etc. This is what is prescribed in injection form. Antihistamine and external medications were also prescribed, and as a result of that, these rashes gradually resolved in spite of their scary look. They resolved quite quickly within 5-6 days. So it's better to try not prescribing even simple medications without analysis done, and not to take them on your own, based on your own opinion after searching the internet. If it's necessary to diagnose and treat any lesions in the area of sexual organs, you can consult dermatologists and venerologists of our paid medical center of dermatovenerologic dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such rashes. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram.